Our next witness will give evidence underneath the protective cover of a restriction order. Those of you who've been here before or been following the inquiry on the internet will know what this involves, but for those of you who haven't, I need to explain it again. The inquiry takes very seriously the protection of the anonymity of a witness who would wish it, and our next witness, Mrs. D, does. The order provides as follows: that the name and address of witness W1921, she'll be known to us as Mrs. D, and any other identifying information, such as her image or a description of her appearance, cannot be disclosed nor published in any form unless express permission is given by me or by the solicitor to the inquiry acting on my behalf. She must be referred to only as Mrs. D. This order will remain in force for the duration of the inquiry and at all times thereafter, unless otherwise ordered, though I may vary or revoke the order by making a further order during the course of the inquiry. She is content to give evidence before you, as other witnesses have done, but her image will not be live streamed. Her voice will, and the transcript will record her words, but nobody will see her image. For that reason, if you are in and around the inquiry afterwards and happen to have your mobile phone out to take photographs for whatever reason, could you please just take care to make sure that you don't, however accidentally, capture her image. Mrs. D.
Mrs. D, your full name is known to the inquiry. Could you please repeat after me? I do solemnly, sincerely, and truly declare and affirm
and truly declare and affirm
that the evidence I shall give
shall
be the truth,
the whole truth,
and nothing but the
and
truth.
nothing but the truth.
Now, I understand, Mrs. D, that for your comfort, you would wish to have a break after 25, 30 minutes, something like that, at a convenient moment.
I may do.
Well, if you do, and when you do, please indicate. Do not sit there in discomfort if you feel that you would like a break.
Thank you.
Mrs. D, on the 19th of May 1986, you went into early labour with your first child.
I did, yes.
And you were admitted into hospital.
Yes.
And on the 23rd of May, you were told you had to have a transfusion.
That's right, yes.
Before the transfusion was completed, it was disconnected and you were sent for an ultrasound.
Yes.
And you describe in your statement that it was all rather strange and you didn't really understand what was going on.
Yes, that's correct.
Can you tell us a little more about that?
Well, I wasn't actually told why I'd got to have the transfusion in the first place. I was just told the doctor said it, you're having it. They put the cannula in, they started the transfusion, and it was about 3/4 of the way emptying when the same sister came in and said, you've got to have it out, you've got to go for a scan. She disconnected me, gave me a cellular blanket to put over the gown that they'd given me, and told me to walk without help, without anybody else, to the scanning for an ultrasound. And that actually involved going down the corridor, out of the building, past the workmen who got scaffolding up, across the grounds to a small single-storey building where I had to have the ultrasound.
And when you got to the place you needed to have the ultrasound, the radiographer was concerned that you were alone.
She was very, very concerned. She was shocked. And she said that she was going to call through, complain and ask for a porter with a wheelchair to take me back.
And somebody did that, and you went back to the ward.
Yes, that's correct, yeah.
When you got back to the ward, you understood that there had been some raised voices amongst the staff.
Yes, the lady in the next bed, because I'd already been on the ward for 3 or 4 days, so I'd met a relationship with the woman in the next bed. And she said, in her words, it had been a bit of a hoo-ha. Raised voices, it sounded like somebody had been having a go, so I thought, oh, the radiographer had phoned and made a complaint and it hadn't gone down too well.
And you've never been sure whether that hoo-ha was about the fact that you'd gone to the ultrasound on your own or whether it was about the transfusion itself?
Yes, because I hadn't been told why I got it. There was no reason, as I knew then, why I should be having one. So I thought, at the time when they took it out, partly thought, was it meant for somebody else that they made a mistake? Was I that person, And especially getting me out of the building, it did raise concerns.
Before you were given the transfusion, were you warned about any risks of having it?
I wasn't told anything about it at all, even to the point I didn't know why I was having it.
Now, as a result of that transfusion, you were infected with hepatitis C.
Yes.
About a year after the transfusion, in June 1987, you didn't feel quite yourself.
No.
Can you tell us what was wrong?
I just started feeling down, depressed, lacking in energy. I just wasn't me. Before I'd been full of life, I did clubs, I was sporting, I'd got a young daughter who'd survived the pregnancy because I wasn't sure, and, I should have been full of life. There was nothing wrong in my life except for me. I felt just like I wasn't me anymore.
You've described that you felt like you were carrying 10 other people around with you.
That's it. I was everything was exhausting.
So you went to the doctor,
Yeah.
And what did the doctor say?
You're a working mum, because I was working full time. You're a working mum. You're going to be tired. That was it. Sort of go away. There is nothing more.
Over the years, you've had a number of physical conditions. Thyroid cancer, several miscarriages, irritable bowel syndrome, fibromyalgia, an enlarged spleen, undifferentiated connective tissue disease, as well as F3 liver disease.
Yes.
You're not sure whether they're related to the hepatitis C, but you often wonder whether they are.
I very much believe, and it has been said to me in the rheumatology department, that it was probably the hepatitis C infection that triggered the autoimmune conditions, which in itself have put me on immune suppressants, and that in itself causes, you get a cold, you get sepsis, you don't, and it makes you feel very ill.
And you believe that there's been really a cycle of illness all arising from the hepatitis C?
I do, yes.
You had to stop work in 1998. Why was that?
I hadn't felt any better from the time I was tired in, years earlier, but I started getting more achy, I was exhausted, I was collapsing on the floor at work. I'd been really pushing myself because I'd been doing really well at work, working up for promotion, and after collapsing a few times I went to the doctors and they gave me sick notes at the time they were called, for exhaustion. And it literally was the most awful exhaustion. I just couldn't stand anymore. Which actually felt really embarrassing because it was just like saying, I can't work anymore because I'm too tired. But it was far more than that, but that's how it felt, and I think that's what other people thought as well. It's just like, you're just tired.
If we fast forward to 2016,
Yes.
because that continued and went on, but by 2016 you were really very unwell.
I was very, very ill.
What can you tell us about your symptoms at that time,
Well,
just before your diagnosis?
Yeah, for months I'd been being sick, physically sick. I couldn't eat anymore. I was losing weight. I went down to just over 6 stone, which was half my body weight. And there was just no reason. I couldn't find, I was having monthly blood tests for my autoimmune conditions, but nothing was showing up. But I just literally, as my family said, I was dying in front of them.
Eventually you were referred to a haematologist.
Yes.
who did a series of tests.
Yes, quite a few.
And you were then told that the test for hepatitis C had come back as a positive. With that first test, what did the haematologist tell you?
Well, he actually phoned me up and told me this over the phone. He said, not to worry, everything else come back clear, but this one had come back as a positive, but he didn't believe it was a true positive. He thought it was a false positive because of my immune conditions and the medication I was on, and he could see no reason why it would be positive. So he'd like to do a second test.
And so you had that second test?
I went back and had the second test, yes.
And then what happened?
Then I received a phone call from my GP surgery saying they'd received a letter and could I go in to discuss it, which I made an appointment and went in. I was expecting this to be a letter from any one of the departments that I was going, either orthotics, rheumatology, anything like that. I went in and I sat down, and the GP held up a public health letter and said, as your drug taking as sex worker, you're at risk of infecting everybody. You've got HCV. I didn't even know what that was. They said you've probably passed it on to your kids and husband, and you might die from this.
You said to him, that's not right.
I said,
it was
that's not right. No, that's a false positive. My haematologist has told me 100% I've had a second test. And he said, no, and he said, no, it's definitely, the second test has proved positive. I was kind of freaked because it always going whizzing around my head was, I'm going to die, but I've actually killed my kids and husband. That's all I could think. That's it, we're all going to die. But it was, I asked what it is, and he didn't know. I said, what can be done? He said, you'll be referred to somebody. And that was it. I mean, I can still picture the room, I can picture the jumper he was wearing, the pen on the desk, everything, the letter. But it was like I'd called me in to say, you're a dirty, disgusting person, a danger to society. I don't know what it is myself, but that's what they're saying, so go away. You'll get an appointment from somebody else. And I left.
As you say, you can still remember vividly the details of
everything
that.
about the room. I won't go in that room. I can remember even the stitching. He'd got a hair on his jumper. I can the whole lot became stuck in my brain. I can still picture it now.
And you still have flashbacks to
I
that
do
day.
have flashbacks, and was later diagnosed with PTSD from that point.
You've described in your statement that you walked out of the surgery feeling suicidal.
I did. I left. I could not compute or work out what I just heard, the consequence. I've been given nothing to help me understand any of this. And I just had a GP who'd known me for a few years basically say I was a drug-taking prostitute, and, I'd put everybody at risk with something I didn't even understand. And I left, and I drove, which I now thinking about it, I really shouldn't have driven in that state. And all I could think of was there was a local viaduct, which I was going to go and throw myself off.
In order to get to that viaduct, you had to drive past your own house.
Yes.
And as you passed by, you realised you couldn't do that to the
Actually,
children.
my son was looking out of the window, waiting for me, because he knew I was desperately ill. He knew I'd gone to the doctors, and he was just sort of, went, Mum, is she going to know what it is, And I just saw his face, and I thought, I can't, however bad it is, I can't leave them to deal with this without me. So I went into the house instead.
It then took a month before you saw anybody again, and on that occasion you saw the haematologist again.
Yes, I did.
What was their reaction to how you'd been told about the hepatitis C?
They were horrified. They were furious. They were really, really angry, as he'd asked for the tests. He'd asked me if I could have about doing the tests. He'd had the tests, he'd had the results, and he was so angry that the GP had told me, because he'd was going to tell me in in a situation where he could explain a little bit about it, and he was just literally furious. He was going to complain about it, he said.
He was able to tell you a little bit more about what hepatitis C was.
Yes. He said, I don't know, I'm a haematologist, because he'd actually been checking for blood cancers, but he'd just screened me for that, for everything. He said it was a liver illness and there were treatments for it, and he was going to refer me off to a hepatologist.
You then had to wait for a few more weeks to
Yes.
see the liver specialist, and you saw the specialist nurse.
That's what I did.
What happened at that appointment?
She was actually brilliant. I mean, she was really, really helpful. She discussed what it was that I'd got, whether I'd, just talked to me to find out about me, and we worked back and found out, and she asked if I'd had a transfusion, and I said yes, I'd had this transfusion in 1986, and she said that was more than likely the reason that I'd caught this, and she also gave me the numbers for the Hepatitis C Trust and mentioned the online support groups.
You then had a liver scan and established the extent of the damage.
Yes.
Did any of the doctors explain to you the ways in which hepatitis C can be transmitted?
Well, no. I mean, obviously, first off, I had the letter saying it was through drugs and sex, and then my hepatologist nurse said, it's a bloodborne thing. But no, but even she didn't give me any leaflets, information, or anything to tell me how you get it, really, or what precautions you should take, or anything. There was just no advice at all. It was just HCV actually means hepatitis C. That's about what I learned. But there was nothing, no. I got given no advice.
And you didn't have any leaflets or anything to take home with you?
There was nothing at all. Absolutely nothing.
Now, you have two very particular concerns about your infection. Firstly, you've questioned why the infection wasn't identified earlier, given that you were receiving treatment for a number of conditions over the 30 years between the transfusion and the diagnosis.
Yeah, I mean, through every pregnancy you get just checked for HIV and Hep B, and it wasn't picked up on. I mean, rheumatology, all the tests I had, all the diagnosis, and I know now that if you get if somebody's going to be started on treatment of rheumatoid arthritis, they test for HCV now. But that was after they'd started me on treatment, so they didn't test me. They didn't think, oh, why has this woman got all these conditions? We can't find out why. I was put on a ward in the early 2000s for rheumatology for a whole week to see if they could find out what was wrong with me. And they came up with the diagnosis of fibromyalgia with the thought that there might be something else. But no, even through thyroid cancer, said on the immune suppressant 4 weekly tests, nobody ever found out until they thought I got blood cancers, and haematologists will screen for everything. I mean, I was at the hospital, so my notes were that thick. Endless tests, endless medications, all the time, never tested.
Your other particular concern is why you were given the transfusion, and you've said that you were never told why you needed it.
I wasn't at the time.
There's also no record of the transfusion in your medical records, is there?
There isn't.
When you applied to the Skipton Fund, you requested your medical records.
That's correct.
Can you tell us a little bit more about what happened then?
Well, I had trouble asking for them, and they seemed to delay in sending them. When I did receive them, there's some notes. I was actually admitted onto the ward on the 19th of May. There's a page of notes for the 19th, the 20th, the 21st, the 22nd. Then it goes to the 24th, the 25th, all the way up to the 29th when I was discharged, having given birth. The 23rd was missing. There's no notes for the transfusion, there's no notes for the ultrasound. There were no notes at all for that date. Nothing, not temperature, not fetal monitor, there's nothing. So I questioned them on this and said, this is ridiculous. Not only have you not got the bit that I know I need, but where is, all the supporting notes, all the nurses' notes? And it was a very lengthy process, which ended up with me putting in a complaint, which was ignored. I sent in a letter, recorded delivery to the hospital saying, this is my complaint, I need you to find these notes, to which they said they hadn't received it, even though it was signed as their mailroom. I actually went up to the hospital in person, went to the reception desk and asked them to bring somebody down from the office to hand them my complaint letter, and all of a sudden they instantly found everything, except for the notes. It took, all in all, about 10 months from initial request for them to supply me with notes that they said they'd got and a letter to say that they thought that due to the time scale and the building moves that any letters from that time, except for the ones that had got either side of that, had been destroyed or lost. And they've never come up with that the day of the 23rd.
So there's no record of the 23rd of May.
No.
But also you've noted in your statement that the discharge letter from your admission has a tick in the box to say that you didn't have anaemia.
That's correct, which is a surprise because I was anaemic from a child. I've always been anaemic, and I'm still anaemic now. I was anaemic before I was admitted, but miraculously I suddenly became non-anaemic through the time I was there. And then ever since I've been anaemic with transfusion level anaemia with the other 3 pregnancies I had. So it's just like somebody decided to wipe that day, my transfusion and my anaemia, for whatever reason.
And you've said that that's what worries you most, that they've hidden the fact
They've
of the
hidden
transfusion.
the fact because part of me is, should I have had the transfusion? Did I need it? It may have been for anaemia. It probably was for the, it would have shown up I was anaemic anyway. But obviously, since looking things and learning, it's like, was I? And because of the arguments when I was at the ultrasound, I personally think, was I given the transfusion on purpose? Was I infected on purpose?
You've said in your statement that the whole situation around the notes and the lack of the records makes you question whether you were deliberately infected because you were young and healthy, and you say maybe they wanted to see what would happen.
That's correct, and that still stands today because I've come across through support groups other women who were exactly the same age because I was 19. I was younger, and they were 19, and they were given a transfusion for anaemia. And there just seems to be a few cases, and it's, why did they do it? Why was there not notes there on that day? Why has nobody ever followed me up? Why did they leave me for 30 years? And why has there been seemed to be such a cover-up over it? If it would just been, a regular, well, we gave you a transfusion, we admit you had a transfusion, and unfortunately people got infections from them, but it seems to have been deliberately hidden.
You're worried that there continues to be a cover-up because of something that happened when you attended the hospital in April of this year.
That's correct, yes.
Tell us what happened.
Well, I'm always at the hospital. I'm always having appointments, and I know as Andy said before, my notes are quite thick from obviously the regular. So I notice them come in when the receptionist gets them out. So I went and sat in an appointment, and I saw them lift the notes, and the receptionist went, and she looked concerned, and I thought, oh no, here we go again. It's going to be a delay in the clinic. Have they put my stickers with the wrong address? But she put it under the trolley to the side, and she called the clinic nurse, and she looked in them, and she looked a bit concerned, and I was sort of, oh no, I'm going to be in for a real delay, and what's concerning about my notes? Because having seen a rheumatology 4 weeks before, and there was no problem with my notes, what's happened now? There was a really long delay in that clinic, during which I had a hearing test, and when I was finally called in, the doctor said that my notes had been, although they were in a real mess, they'd been messed with, and that he couldn't find my previous clinic letters test results to compare the tests I'd had that day with the previous clinic. So could I tell him about what had happened between the last clinic and when I was attending? I did actually have an oncology follow-up letter from a clinic 10 days before with me printed to show him, because they cover some of the same things, with some blood tests and stuff, so I didn't have to have them done again. I showed him that, which he copied some notes down.
Can you remember a little more clearly what you recall the doctor saying about the notes?
He said that it looked like somebody had messed them up, and that he couldn't therefore find, and if he tried to look through, it could take maybe half an hour to an hour or whatever. It would, he thought it would take too long to even look through them all because they were in such a mess. It looked like somebody had messed them up. I don't know what somebody's been doing with these, is what he said.
And you're worried that someone's gone through your notes because you're giving evidence to the inquiry?
Yes, because nobody was aware that I was going to be giving evidence before. At my rheumatology appointment, my notes were fine. And since then, all of a sudden my notes are a mess. They're not in order. There's pages hanging out, which there weren't at the previous appointment, and there's no reason for anybody to do anything with those notes between one appointment and the next.
You're represented by solicitors, and the solicitors contacted the trust.
Yes.
They have denied that that is what was said by the doctor,
Yes.
and denied that the notes had been accessed by anyone inappropriately. What's your response to that?
I say that it is a further cover-up because the notes were in a terrible mess. The doctor did say that to me. I could see that they were a mess, and the fact that they used the word inappropriately means that somebody had looked them, but they presumably thought it was appropriate to look through them. But they haven't given me any reason as to why they were in a mess. I mean, there's no answer to that at all. They've just, got back to the solicitor, and I've seen that letter, and it doesn't explain it.
I want to move on from that.
It's fine.
You had been diagnosed with hepatitis C in the autumn of 2016.
Yes.
And in January 2017, you were told you'd be put forward for treatment with Epclusa.
That's right.
You then had to wait to start that treatment until the August in 2017.
Yes.
Why did you have to wait?
I was told I would have to wait until the NHS funding was available. I was told it was done on a month-to-month basis, that who could have their treatment funded that month, and that you wouldn't know who it was going to be until they'd had the meeting that month and decided who was going to get the treatment, so that if somebody suddenly became a really bad cat, but it was, you didn't know when you were going to get treatment. The nurse said that she was retiring in 5 years' time, and I may have had the treatment funded by then.
You feel you shouldn't have waited for treatment?
No, I didn't see why on earth I should wait for the treatment, especially as I'd found out that it was the NHS that had actually given me the infection and caused so many medical problems associated with that, and the fact that I needed the treatment. They should have just made it available there and then.
And while you waited for the treatment to start, did you have any support?
No, I had no support. Literally, I was just left on my own. It was just like I was abandoned to sort of be on your own. There's no advice, there's no counselling, there's no help. You've got this, and you might die before we get the treatment. I mean, that's how I felt. I thought I was going to die waiting for the treatment. Because they seemed to have said, you're really ill, you need this. We're not going to do it until they say that it's going to be funded. And I just waited until I got about a week's notice of the treatment, and it was just like, yes.
What would have helped while you had that 7-month wait? Obviously not having the wait, but if you had to have the wait, what would have helped?
Well, I thought actually right from, I think anybody finding out they've got an infection, and especially in the way that anybody's had infection via, the NHS basically, that you should have counselling straight away. I mean, I went through cancer, and I had, I got sat down, told the diagnosis, I got told what the treatment was going to be, the whole treatment package, you get support lines, you got somebody there to talk, the leaflets, everything. And I was well looked after when I had my cancer. This just abandoned me to the fears I had, the illness, the complete lack of knowledge, almost like they wanted me to go away and they wished they hadn't found me. I think there should have been counselling. I actually asked in February the 1 year to went to my GP, a different GP because I won't see him anymore, if I could have counselling, because I felt that I'd gone into shock when I got diagnosed. I felt I wasn't coping. I thought I needed help. And they said they would put me forward to it. And I finally got, 12 months later, I got the offer of talking therapy. I went to the appointment, a young woman sat there, and she asked, first I got a call saying, would I go to a group therapy session? And I was like, no way am I sitting in a room explaining why I'm like I am. So then I had an appointment to see somebody singly, and I went to the room and she listened to me, everything that happened. And she was getting a bit sort of, while I was talking, and then she says, I'm getting really stressed just listening to you. which just gave me no hope or, of any help. I mean, I just felt I've just opened my heart, given some trust in somebody which I'd found really hard since finding out everything. And she just, like, I can't cope with this. And she actually, I had to go back and be referred to somebody else because she literally couldn't cope. She didn't understand the situation and she couldn't help me.
So that period of counselling came to an end.
It came to an end rather abruptly, yes.
Eventually you were referred for some sessions for cognitive behavioural therapy and eye movement desensitisation and reprocessing treatment.
Yes.
You've said that therapy came to an end for reasons that we'll come
Yes.
to, but you've said that the fact that the number of sessions was limited to 10 to 12
Yes.
was in itself difficult.
It is, because if you get therapy and you need to talk through something that has also not just been so traumatic, but it's ongoing, and you need to take the time to do it, to be told at the start, well, you've only got 10 to 12 sessions to actually be cured of your psychological problems, your depression, your anxiety, all this has got to be done because we only get funding for 10 to 12 sessions. It's like adding extra pressure to something that's awful already.
While you were on the treatment with Eclusa, can you tell us how you were?
Well, I was hoping to actually have no side effects because it was, all I'd heard was that it's really good. You take it for 12 weeks, you'll be fine. But I wasn't. I don't know whether it was just unlucky or whether it's the association of the multiple drugs I'm on and it reacted with those. I was very sick. I was very tired. I had headaches. I couldn't sleep. I was shaky. I got hearing loss, worse than I had before. And I became desperately in a dark place that I'd never felt. I mean, I'd been depressed, but this was just horrendous. And it scared me. And then it cleared a bit. And the next day, and I realised that it was sort of 2 to 3 hours after I'd taken the tablet, this just wave of overwhelming awfulness that it takes you to different places. It's like you've been taken out of yourself and there's just this scared shell that you can't actually see life straight anymore. It's like you're in a fishbowl, life doesn't seem real. It was horrible. I felt out of control, and it went on and it went on, and I started getting dizzier and I felt more down. And from being able to cope in a way, I had to refer to Andy, but he said the same. You learn to do things. I dealt with the cancer. I'd stayed confident, looked after my kids. It really knocked me sideways, and I haven't been the same since that. I mean, I was having the tests while I was having it as well, and I'd heard great things about people's numbers dropping. Mine took till after 12 weeks to drop, so I was scared it wasn't going to work. And actually the nurse didn't think it was going to work, but the test 4 weeks after I'd finished showed it had actually cleared, which was a bonus. But I've never felt the same since having it.
Your hair turned a different colour
Yes,
as well.
I had. I mean, if you imagine that I'd been ill, I couldn't be the fit, healthy, happy person already. Then having gone down to 6 stone, I was skeletal and I felt horrible. The one thing I had left was waist-length hair. A lot of it. The treatment, it started changing colour as it was going out, and each month my hairdresser said it's like looking at the rings on a tree. The timelines, it went yellow, it went a funny colour, and then it just all started breaking off and falling out, and ended up with just horrible stubble. I know it sounds stupid because everything everybody goes through in the illness, that should have hit me so hard. But it was just that last little bit of you. It was me. It was just that last bit of nothing to do with illness. I'd still got my hair. Stupid and fine, but it's just that one thing that kept me going.
You've said in your statement, my hair was the last thing I had, and that destroyed my self-confidence.
It, yeah. I just didn't feel like a woman anymore. I didn't feel like a person. I was just this ill skeletal thing that,
And you've continued to feel really quite unwell, even after the treatment.
Yes, I have not felt well since. I've never felt well. I mean, I haven't felt well since 1987. But I've been through everything else and gone through everything else, and I've just felt worse and worse and worse, and I was so hoping the treatment would make me better. All it did was get rid of the Hep C. Well, all I did, that sounds like it's belittling it because it's a big thing to get rid of it. But that's it, it's done that. It hasn't changed my life, it hasn't changed my health. It hasn't given me that I'm okay now.
Mrs. D, I'm conscious we've been talking for a little bit more than half an hour. Do you want to take a break at this point?
No, I'm fine, I'll carry on. I'll just keep crying in my tissue if everybody doesn't mind. Yes, please. Thank you.
As you say, you've cleared the virus.
Yes.
And you've now been discharged from the liver team.
Yes.
But that in itself is making you anxious. Can you explain why?
Because it was, you've cleared it, goodbye. I was told I got, F3, nearly F4, I got severe fibrosis, it was obvious, nearly cirrhosis, and I'm on a lot of other things, and there's no follow-up. There was no, I've already had cancer. I'm on immune suppression, which makes you more likely to have cancer, and having had hepatitis C, there's the high risk of liver cancer. And I hoped, or I think I should, be checked every 6 months or so to catch something early. It was 30 years before they found that. I'd like them to catch something like that a bit quicker. But it's not the case. It's no, you've cleared it, you no longer lead. And I for my mental okay, for just the knowledge that every 6 months they could check there's nothing else going to rear its ugly head, would be at least helpful, but they don't want to do that.
Since your diagnosis,
Yes.
your rheumatology team has changed,
Yes, it has.
as has your oncology team,
Yes,
and you think that is because of your hepatitis diagnosis?
I do. I found a change in an awful lot of people as soon as I got that diagnosis. I wouldn't see the consultant I'd been seeing for 10 years. I'd suddenly have to see somebody else. The 4 weekly blood tests, which became almost like a community day because you'd go and you'd see the same people, you'd see the same phlebotomists, would be chatty. They stopped being chatty. And where I have to have my blood tests, it's lots of little cubicles with curtains, and they always leave all the curtains open, so it's like 5 or 6 people having blood tests. And of course it said special precautions on every test after that, so that they'd get the gloves. And then you see other people looking, and you're thinking, they're getting gloves to that person, they've got something. But it was the reaction from everybody. It's like the doctors suddenly didn't want to see me. I don't know whether it was suddenly, perhaps they felt guilty they hadn't found it, or they knew somewhere in my notes that he'd have said it and hadn't told me. They didn't want anything to do with it. The rheumatologist stopped seeing me, who'd been seeing me for years. Yet he saw me a month or so ago and said, when the appointment before the last one, and he said, "Oh, I saw that your infection was from a transfusion." And he mentioned that. And I was just like, yes, it was. Yet he saw me then, and he hadn't seen me for years. My oncology team was the same. All of a sudden, the person who'd been seeing me didn't want to see me anymore. It made me feel dirty. It made me feel like I was in the way in their clinic. Like they suddenly wanted to shuffle me off into like the cloakroom or something. Somebody else go and see that person because they've got that. And that's how I felt.
You've also had a very serious issue with your now ex-neighbours.
Yes, I have. Well, I think it's ex-neighbours. It's, because I never found out who it was, which is the reason I'm getting emotional, because I know it's coming. I obviously got in touch with the IBSS and I, got letters. One of my letters didn't arrive. I didn't know it was sent out, but it hadn't arrived. The only reason I know it didn't arrive was because I had a letter come through the door, through the post, my name on it. I opened it up. At the top of the letter it had got my name and my payment beneficiary ID number, for better, I don't know what else you'd call it.
The EIBSS reference
That's
number,
it,
I think
yes.
you've called it.
And somebody had written, They didn't want dirty-blooded people like us in their community. They didn't want to be in the doctors with me. They didn't want to be sitting on the bus next to us. They didn't want their kids to have to go to the same school as my kids. They thought that I should leave or hurry up and die, but I scanned down and the worst bit said, and I don't want anybody else in the room to be upset by this.
I'm happy to read it if it's too upsetting for you.
Yeah, if you would, please.
They said that people like us should be taken into a field and shot, and then our bodies burned like a cull of cows and badgers.
Which is kind of pretty difficult to take about yourself. It wasn't just for myself, it was for my kids. I mean, they were saying it about my kids as well.
You shredded the letter and
I
got in
wanted to
touch with
destroy
the
it.
police.
Yes.
Sadly, things didn't end there, did they?
No, it didn't. I mean, I did phone the police, and actually I spoke to a woman police officer who said that she'd actually experienced, she'd been a police officer in the 80s when she'd experienced stigma with the HIV and AIDS people. So she was concerned that this might escalate, but hoped it wouldn't. Then we had dead pigeons, dead rats, dead mice, dead squirrels thrown at the front door on the drive. My son is disabled and we have a wheelchair access van, and somebody'd sprayed tomato ketchup across it, leave or die, and just doing it like blood and dirty blood, in words that could run it down the van. You never knew what to go out to.
That went on for quite some time.
It did go on for some time. I mean, I had security cameras up, but where I lived, you couldn't see. But you could just see the stuff being thrown on to the drive. I mean, the cameras stopped the van being sprayed, but you couldn't see who. You could just see these dead things being thrown at the house.
And you and the family were terrified that perhaps something worse would happen, that the house would be burnt down.
We did. I mean, it had made it very clear that it was like leave or die, and I was petrified. I mean, I had to make my children aware that there was a threat. I had to say, don't go outside the door, because I didn't want them to have to see these things, so we had to clear up. My children became desperately, desperately miserable. They stopped seeing their friends. They had to go into CAMS, the mental health service, but then they didn't trust to tell them just how bad it was or what was going on, in case, in their minds, maybe they might not want, they might think the same things of them, to the point that my one son wouldn't go to college anymore. My other son was at school. He wouldn't go to school. He's meant to be doing his GCSEs now. He hasn't been to school in months.
Oh.
It destroyed him. He didn't want to live anymore. He didn't trust any boys. As if this is what life is like and how people are in the world. What's the point?
After about 5 months, you were able to move.
Yes.
Move house.
Yes. I had to wait for the council because of the financial position that my husband and I had been put in through the illness. We had to rent from social housing, so we had to wait for them to find somewhere and agreed and for us to move.
But since you've moved house, it's obviously got an ongoing impact, as you've said, on you and your family.
Yes.
But more recently, you've again had issues with letters from the EIBSS.
Yes. I mean, I did complain to the Royal Mail at the time when the one letter, because it was obvious that the one letter had gone missing because it had got my EIBSS number on, which showed that somebody had read it. I again didn't have our EIBSS letters arrive, and 2 that did arrive arrived in damaged bags that had been opened, very obviously been opened and glued back down to the fact that it actually glued the letter to the envelope, so it ripped when I opened it. And I'm constantly in touch with the Royal Mail. I've been in touch with the police. They've said it's down to the Royal Mail. But it's it's really concerning because it happened at the previous address. I've moved. And the same thing is happening at a completely different address, but it's all the letters from the same place. Now, I got in touch with the IBSS and said, it says NHSBS on the back of my envelope, please send it in a plain envelope, which I thought would be a very simple solution, so that if anybody in the postal system, because by then I was thinking, it's got to be somebody in the postal system because it's happening time after time. I thought it would be a really simple option, and that didn't happen as far as I know.
You've had 2 letters arrive in plastic bags which have been opened.
Yes.
And then last month another letter has gone missing.
Yeah, I mean, I really, really ripped into the Royal Mail over it because it was the new address, and I was like, oh my God, my kids are somebody's going to find out where we are again. The whole thing's going to start again. And they said 100% it was all going to be sorted and everything. And then a letter didn't arrive. My thoughts personally is that whoever's opening them and causing this problem has gone, I can't send it in a damaged bag because it's going to be investigated. I'll just hold on to it and it'll never get there. I mean, they said you'll have to wait 50, even though they knew all the trouble with the 6, 7 letters that I'd had a problem with. And it is only from this place, no other post goes missing. They said I've got to wait 15 working days to say it was missing. So I had to wait that, and then I had to phone them up again, which is quite stressful and traumatic, having to phone up again and again and try and sort this out.
You say you ask the EIBSS to send things in plain envelopes, but you don't think that kind of been happening because of the most recent letter going missing.
Yes.
And so what have you asked them to do now?
I've now had to actually ask them to send me everything by email, which most people would think is an easy thing. But because I have photosensitivity due to the autoimmune conditions, which I believe have been triggered by the Hep C, I can't go in front of computer screens and everything. I'm very light sensitive. I have to wear 50 plus factor B in front of, so I don't go on computers. I only have a phone. So accessing these, which I don't think my husband or kids should have to do, is now making it difficult for me to do that. I don't have that facility or to print them off or anything.
And all of those incidents have had a very significant impact on your family,
yes,
as have your infections.
Yes.
In your statement, you've put it like this. It's put pressure on all of us. It's caused stress in my relationship with my husband. It's put stress on my children. I've lost friends, and there are family members that I no longer see. We don't have a social life. We don't see anyone. I've hated myself for years. This in itself has had an impact. If the kids want to do something, I'm too ill, too tired, or can't afford it. I haven't been the wife, the mum, the sister, or the daughter that I could have been. All of these things have been taken from me and from my family.
Yes. I mean, it's to the point that it's caused such distress. I've had to bring my brother with me. I mean, my husband is incredibly supportive, but because my children are still traumatised and won't leave the house, he's had to stay at home with my children, and I've had to come here. So I grabbed my brother and my sister-in-law at the last moment and said, you'll have to come, I can't do this on my own. I don't go anywhere on my own anymore, in case there's stigma, in case I have panic attacks.
I want to move on to talk a little bit more about the financial assistance. We've talked about the letters.
Yes, that's fine.
But just in terms of the processes, as soon as you were diagnosed with hepatitis C, you registered with the Skipton Fund.
Yeah, because my hepatitis C nurse actually suggested it. She actually told me about it. Because as soon as she saw it, she spoke to me, she said, no, you've got this through this, they should pay out. So I applied for the notes. One problem I have with it is that you apply to the Skipton or your IBS, and then you have to wait to get all the information out of your medical professionals. You have to go try and get the notes, the proof, then you have to get the form signed. I sent it in, they asked for more information, it got sent back. Finally, I got it all sent in and it got approved. But this was well over a year. And so, they did agree in the end, and the same with the SCM, they've agreed that, so I get that. But the fact is why doesn't somebody get paid from when they register? Why doesn't somebody paid if you're infected and it's from that, why don't you actually get back paid from when the scheme starts for everybody? Because everybody's been infected. And it's not my fault or anybody else's fault if they don't get diagnosed for 30 years instead of 20 years. Why did I not get payments from them? But even when I've got diagnosed, they go, yes, it's true. We're not going to backdate it to when you registered. We're only going to pay you from when you could actually get all the notes and the information out of everybody, which was incredibly difficult, which causes more stress, more time and everything else. I mean, yes, and with the uplift of payments and things, it is going to make it easier on myself and my children, and it's, I'm grateful that's going to help, because I've been pushed onto a life of benefits. My husband had to give up work to look after me, so it's really ruined us financially. I mean, I started as a shelf stack and I ended up as a key holder of a lot, a national store. I was working for one of the large nationals. I was training management. I'd take over, I'd go, I could do the whole job. I should have been on an incredibly good wage. My husband was working, all gone. And now so this little uplift will help. But we haven't got a house. We haven't been able to buy a house because of it. And again, the same as Andy said, you don't know if it's going to carry on. You don't know whether it's going to stop. And there is that thing where anybody else who's just been diagnosed, somebody who's diagnosed, why should we have gone out without the payments from back then? Just because nobody found us and told us we got this illness? Because we were infected 30 years ago. Why should I only have 12 months payments?
You also applied for funding for a specialist bed because of the joint and muscle pain you suffer from.
Yes.
And that was turned down.
It was, yes.
What are your observations about that?
I phoned them up and I explained the problems that I'd got, and they said, yes, you can apply. And one big problem I have is the inconsistency of information you get from them, because you'll speak to one person, they'll say one thing, and the next time they'll say something. They said I need a letter from the doctor. I went to the GP, and they said, yes, they'd write a letter supporting, saying that I suffered from these conditions, and they thought that a specialist bed would help me. That I'd been diagnosed with hepatitis C, I got all this. Which I phoned them up and I said, got this letter, and they said that'll be fine. And I phoned up 30 days later saying, I haven't had a decision, is it going to happen? I had to go around getting quotes, because you have to get quotes for the bed. And they said, no, it's not good enough, because she said haven't actually said it's the hepatitis C that causes the pain. And I said, oh, right, okay, well, it's difficult to say that. And I went back to the doctor and she said, well, no, hepatitis C itself doesn't cause the pain. It can cause conditions that cause pain. But she wouldn't directly say that hepatitis C caused pain. So even though I was having all those problems, they constantly kept saying no, to the point I didn't bother going back, because there was no way. My GP said, we don't know enough about it really anyway to write these letters, but we've said we support you, and they've turned around and said no. I mean, I was going to ask for the support for the counselling, because I thought I'm getting nowhere with the NHS. I could do with that money to help counselling. But when you've gone with your begging bowl out and they've gone, no, you don't want to do it again. It's a horrible process to have to ask. And to go through a process when you get what you think is enough, you have to go to the doctor and say, please, can you do this? Please, can I have a bed, please, sir? And then they go, no, actually, the wording's not right. So I haven't asked for the counselling or anything else. And I don't think I would.
You've just given up?
I've given up asking for anything like that.
Mrs D, those are the questions I have for you. Before I ask Mr Locke whether there are any points he wishes for me to raise, is there anything else you would like to say?
No, I think I'd actually just like to thank all the support groups and people who've been there for me, because nobody in the NHS was. The only way I found anything out is by some of these wonderful people, and the people who aren't here as well, who've helped me to get through this, because I was just abandoned by it. And I really do hope that one of the recommendations is, from this inquiry, that there is the counselling and the support and the help there. And I mean proper counselling support by people who fully understand how this affects people. And that's put in place from day one.
I'm just going to turn my back.
That's fine.
Just one point Mr Locke asks me to raise, and that is that your we spoke a little bit earlier about the cognitive behavioural therapy and the EMDR
Yes.
that you were having and started.
Yes.
Why did that come to an end?
Because I was going through I just started that when we started getting all the death threats. I'd had the letter, the stress, the house move, and they said that it was getting in the way of my treatment because obviously my anxiety and everything just went up a level. So it was like being beaten with another stick. It was like, finally you've got some help. And because of the infection and the stigma, that stopped me even having that help. And she stopped it, and then because I couldn't go, the sessions had finished, so I'd have to go back to the GP and be referred all over again, knowing that I could go back and see somebody who probably doesn't understand, and I'd still be under the pressure to be fine after 10 half-hour sessions, which isn't going to happen.
Mrs. D, thank you very much that despite all the reasons you have to feel anxious, you have had the courage to come and tell us your story as you have. Thank you. We'll take a break until 2:30. 2:30.